I've now been a junior doctor for 5 years and I'm just coming to the end of my GP training, which is 3 years after your houseman. So that finishes in February next year, so not long to go. Big exam in 2 weeks. And then I need to decide what to do from there. That will always involve the NHS. I'm quite good actually at insisting that I have some work-life balance. So I work really, really hard when I'm there in the day, but I always try and make sure that I get away on time to see everyone at home. Obviously that doesn't always work because you're not going to leave if there's somebody, a patient that needs you, but I am very, very good at organising my time. I've always had to be, so, you know, that's it. But, you know, I've worked Christmas Eves when everybody's gone away and I've had to join them later and join birthday parties later and things like that, but, you know, that's been part of the course. What worries me most about this is not only will pay be affected, but also the hours that we work. And we do work very, very long hours. I think there are lots of myths out there that we're protected, that we do 48 hours a week, but we don't, because what people don't realise is that's averaged over 6 months. So in the last year I've done paediatrics and I've done obs and gynae. And in both of those rotations I have worked 72-hour weeks, rotated. Not overtime, not extra time, rotated hours, 72 hours. 12 days on the trot. And I'm worried that how could that be made even longer? How could that 72 go to 100? Because I can tell you, when I've done 12 days on the trot, most of them long days, 72 hours a week, I can barely speak when I go home. People leave me alone. I can't have conversation because I just need time out to chill. And it really, really worries me that my colleagues are going to be pushed beyond that point. And to be fair, that point is far enough. If people are pushed into lots more out of hours, antisocial hours, their training actually becomes service provision. It's not training anymore because you know and I know that we don't get trained outside of normal working hours because there isn't the staff level to do it. So the training also gets threatened. Well, it's going to affect women obviously because going on maternity leave is something that they have to do, because in the 15 years or so when they're junior doctors, that's when they have babies. We know that they don't have them when they're 55. You know, I'm not going to go on maternity leave now. I'm lucky enough that I've done that, but most of my colleagues aren't. And so they will be looking at that now as a calculation, thinking, is this going to damage my career even more? Because it's pretty hard going on maternity leave and coming back as a doctor. Obviously, I'm surrounded by GPs who are really mainly women, and you know their training goes on for years and years. I know GP trainees where their training will go on for 12 years because they take a year out, they have a baby, they come back, do a bit more. And so I think the contract for them is really worrying because they're thinking about where they'll be when they come back, what will it mean for them financially, and what will it mean for their career progression. So at the end of it, are we going to have a whole cohort of absolutely ruined doctors because they've been so emotionally exhausted, who aren't earning enough to live in this country, who haven't really been trained as well as I was?